Hello everyone, this is Dr. Radhalakshmi Senthil, Senior Consultant Paediatrician at Lotus Speciality Clinic. Today we are going to discuss a very important topic, which is bowel habits in infants and young children. Newborns tend to open their bowel very frequently, which is roughly about 5 to 8 times a day. As they grow older, after 6 months of age, they tend to open the bowel 2 to 3 times a day. By around 2 years of age, majority of the children open their bowel once a day. This is a normal, regular, expected routine. However, the bowel habits are very highly influenced by the food habits and the suitable time for toilet training. Infants less than 3 months of age who are being exclusively breastfed may open their bowel up to 5 to 8 times a day or with every breastfeeding. However, even in children who are exclusively breastfed, there can be moments where these children may not open their bowel for up to 10 continuous days. Both extremes are acceptable and they are normal, provided your child is comfortable, there is no vomiting, there is no tummy distension, and your child is still passing gas. Once weaning is introduced after 6 months of age, the food habits may influence the bowel habits of these young children. So it may be a good idea to enhance the fiber content in this weaning diet. Therefore, they are able to pass their bowel movement easily. Apart from the food habit, suitable time for toilet training is important to make sure that the bowel habits are regular. Some children are trained as early as 6 months of age to do their potty at particular time of the day. This may appear successful initially, but majority of these children will lose this habit of toilet training around about 13 to 14 months. So the ideal time for toilet training is roughly about 16 to 18 months of age. So I kindly advise all the parents to not to rush with toilet training before this particular age. Reason being, it can be extremely difficult to train these children if they are not mentally ready. I do know a lot of patients who attend the clinic saying that the children are not toilet trained till 4 to 5 years of age. They are either scared of the toilet area or majority of them relate opening bowel to be unhygienic and they dislike this completely. So it is easy for them to control their bowel movements and therefore they get constipated. Unfortunately, once they are constipated, it becomes a vicious cycle. It only worsens further constipation. Eventuality is a constipated stool is very fat and hard, and it goes to a stage where this infant finds extremely difficult to expel this stool matter from their system. At that time, they may require a medical assistant, or if they try to pass on their own, they suffer a lot of trauma to the lower intestine and leads to injury of the lower intestine and scarring of that area, which leads to pain every time they want to open up the bowel. These children initially related bowel habits to either fear of the toilet area or dislike of opening the bowel. Now they will relate opening bowel to pain. As a result, they further worsen their constipation and their pain also gets worsened with this. So what can we do to help these children? First, work on their diet. Make sure that there is a high fiber intake in their diet. Please make sure to avoid too much intake of milk products, bread and biscuits in their diet. Food substance such as ragi, curry leaves, ginger and even apple can cause constipation. So if your child is suffering constipation, it might be a good idea to avoid these kind of food. On the other hand, slowly work on their toilet training. If they are not ready, allow them to be mentally ready to use their toilet chair. It may be as long as 4 to 5 years of age. It would be sensible to wait until they are ready. If you need help during that time, you will need to work as a team with your pediatrician and your child to avoid chronic constipation. So, constipation can be a vicious cycle. It may only get worse and worse if you do not know to cleverly manage these children. These children and the family will require a lot of help from the pediatrician. And remember, some of these children will require medical management for constipation for a longer period until they are mentally ready to be toilet trained. It is important that the parents are cooperative for the same reason, to help the children achieve a good bowel habit. Thank you. I hope this video was useful. If you find this information useful, please like, subscribe and share.